it's Angie McGue, nurse practitioner from Essential Infusions Plus. I'm here with Tammy, one of my nurses, and we are going to talk all about our Hot Shop membership, GLP-1, what all the fuss is about GLP-1s and why we are big proponents of them and what we recommend for our patients. So welcome. So glad to have you. Thank you, Tammy, for joining us.
Hi, glad to be on.
So a lot of you know, if you don't know, GLP-1s, some of the more common words, names for them, semaglutide, tirzepatide, Ozempic, Wegovy, Mounjaro, those are all of the common names. I think a lot of people know what they are. And I think a lot of people associate them with weight loss, but there is so much more to these things than just weight loss. So first of all, let's talk a little bit about why they're so great for weight loss. So what these medications, actually peptides, do is they help you signal your body to do the right things. So they slow food down going through your GI tract, and they help you keep fuller longer and stay fuller faster. And they also can work on that brain component where it can actually shut off some of your sugar cravings, some of your other cravings and such. So they're very good for food addiction, which, let's be honest, that's a real thing in America today. We have created a monster by associating so much of what we do for pleasure and even for when we're distressed or sad with food. Let's, when you're sad, you eat a carton of ice cream. And when you're happy, you eat a whole cake. And everything we do is revolves around food in America today, I think. I'm pretty sure.
So true.
That's, I really struggled for a while when my kids were younger with how to reward them without food. How to not say, oh, let's go get ice cream. You did really well at your game, or here, have a Starbucks gift card, or let's go get whatever. It's hard. It's really a struggle for Americans, I think. And we've created this, and it is out of love, I think, but it has had some bad side effects. But so
For sure.
GLP-1s are definitely really good for weight loss for most patients. Now, there's definitely a group of patients who would qualify for weight loss with their insurance. So I always recommend my patients, if I think they would qualify with their insurance, to go through their insurance. But there are many people who their insurance doesn't cover them or they don't qualify, that I will still put them on it, because obesity is such a problem in America today and puts you at so much higher risk for cardiovascular disease, cancers. If you didn't know that, you're at higher risk for cancers, joint problems, all the other issues associated with obesity. And if we can fix the obesity problem, you can prevent long-term complications with it, or even reverse some of those by getting your body weight under control. So I did want to mention a couple of other things, because I know some people are aware of what GLP-1s do for weight loss, but they are also really, really important for lots of other things. They are working really hard on studying all the potentials for GLP-1s. But there are some studies that show that they can activate brown fat, which is a good fat, and increase your energy expenditure. So as you're moving and working out, you're actually burning more energy. And that can help with the weight management. But it also can help with the inner lining of your blood vessels. And if you don't know, that's getting a lot of attention more so now, because we understand that cholesterol, a lot of people associate cholesterol with a higher risk of heart disease, because that can clog up the arteries. But they're really paying attention to how the intravascular lining plays a role in heart disease and vascular disease, and keeping that vascular lining smooth and slippery so that the blood flows well and nothing sticks to it. So that's why it's so important to understand that these play a role on the health of the inner lining of your blood vessels. And they can greatly reduce your risk of cardiovascular events. It can decrease your blood pressure. It can improve the microvascular, so the tiny vessels in your body, their function, and it can actually decrease inflammation. And so for my patients who've been on it for 6 months or a year, their blood work reflects this. Their blood work reflects they are not as inflamed. Obviously their weight has changed, but they are also feeling better. We see this in our patients. It can also inhibit liver inflammation. And if you don't know, liver disease, fatty liver disease, is on the rise in America, again, related to our food. So 40 to 50% of us have fatty liver disease. We don't even know it. And so really inhibiting inflammation of the liver can really help your long-term health, as your liver is a filter for all things that go into your body, and you need it to function well so that you're not hanging on to toxins and you're metabolizing your hormones correctly, all of that stuff. It can also help with neurological diseases. So they're studying it for like Alzheimer's disease, for the inflammation in your brain associated with that, and the tangles associated with it. So super important to look at this. There's also been studies that show that it can inhibit the growth of prostate cancer and possibly um, other different kinds of cancers as well. So there's a lot of things it can do. I do also recommend it for my autoimmune patients. So anyone with an autoimmune issue, they have an immune system that is not working properly and they're more inflamed. So I'll recommend a low dose for the inflammation for that as well. And it does help with pain for people with joint pain. So lots of things we can use it for, not just weight loss. But we do have a membership for our hot shots. And Terry's going to talk a little bit about that.
So our new membership, it comes as a monthly membership, and with this membership, you can either come into the office and get your injections weekly, or you can come once a month, and we will give you your 4 weeks of injections to take home with you after we teach you how to inject yourself. And when you come in for that monthly visit, we'll take your measurements, we'll get your weight, we'll talk about your diet. Because here's the thing, these medications are great, but we also need to do them in conjunction with eating well and drinking well and exercising. So we're going to, track with you on your journey and see how you're doing and encourage you to keep going and do these things along with the medications. Also, you can come in weekly and get free B12s with the membership. And then we'll also be checking your labs at the end of every 3 months. And then you'll have a little mini consult with Angie again, where you guys will discuss, are you going to continue to increase your dose, or are you going to then be on a maintenance dose? Because these are great to stay on long term at low doses also.
Mhm. Yeah, so a lot of our patients will get to the goal weight and they're like, then what? Well, then we wean you down to the lowest dose that works for you. And we keep you there for the other advantages that we just discussed. As long as you're doing well, I think it's great to be on these long term. We want you to decrease your cardiovascular risk. We want you to keep your inflammation in check. It's really important to do this for long term health. So, coming from someone who's been on one for long term, I think they're a great option. Now, there are a few patients who don't qualify for them. So that would be anybody with a history of pancreatitis or medullary thyroid cancer, which is a specific thyroid cancer, or a multiple endocrine neural syndrome, which is a specific thing. And if you don't know what that is, likely you and your family members do not have that and you would be okay with it. Gastroparesis, so someone who's had issues with gastroparesis, it might be a problem. Side effects do include sometimes nausea and constipation, I would say, are the biggest ones. So we talk a lot about poop at EIP. It's really important to make sure you are excreting your toxins daily, at least one time a day. And so we will work with you on that too, because we want to make sure you're figuring that out as well. So again, excretion is super important. We have lots of tricks up our sleeve on how to do that, but we want to make sure you are having bowel movements at least once daily, if not twice daily, to really help you detox. It is important to understand as you lose weight, one, fat holds onto your toxins. So when you're losing fat, you're releasing those toxins into your body. So that's why it's super important to drink lots of water, flush it out, and to have daily bowel movements. It's also important to realize our goal is not to lose weight in general, but to lose fat. So we are big proponents. Resistance training, really want you moving and using weights because we want you to preserve that muscle mass, but to lose the fat. And so our goal is not drop 20 pounds a month. That's not our goal. Our goal is to lose it slowly, but to preserve the muscle mass and really get you optimally in the shape that is best for your overall health and long-term goals. There is so much we can do. We also have personal trainers available to talk to you as well. And lots of people here to support you because we really want you to succeed on this journey. And again, our goal is always to help you thrive, not just survive. And a lot of what we do is focus on preventing long-term issues and changing things that we see in your lab work initially. And I will go over those with you, not just in our initial consultation, which we do have to have an initial consultation to prescribe these for you, but in the 3-month checkup, we will look at these labs and track with you and see how you're doing and making sure we're reversing the processes that we have seen early. Another thing I do recommend for a lot of my patients is a continuous glucose monitor. Um, I don't see a lot of patients go high, like low blood sugar on these medications because that's not necessarily how they work. But if you are running high normally and you drop to a normal level of blood sugar, you can feel kind of crummy just because you're not used to that. That doesn't mean it's a bad thing. It just means your body has to adjust to being normal again because it's used to not being normal. And so we work with you on that. But continuous glucose monitors, which I'm always happy to write for any of my patients, are great tools to use even short term, a month or two, to track your food and see which foods are causing a spike in your blood sugar, and which ones that you should really avoid and how to eat. Again, another tool to help you optimize your health long term and learn how you individually should eat and how you individually can exercise and how you individually can succeed on your journey. So this is available at all of our locations. So any one of our locations can do it, and we're happy to talk to you more about it. But we wanted to introduce this program to you and let you guys know that this is new and improved, and we're so happy to join this journey with you guys. So
Yes.
reach out to some questions. Anything else, Tammy, you wanted to add?
Oh, I just wanted to say thank you to all our patients to continue on this journey with us. And we're always looking to improve it for you. And that's what we're trying to do here. So please continue to track with us and we will be there with you to keep going here.
Yeah. Okay, guys, we will talk to you soon. Thanks for joining us.